11A, flexibility. And this also goes in line with, I think it was Chapter 6 from the ACSM textbook, the guidelines. So objectives. We'll talk about low back care in the next, and issues of the low back associated. That'll be in the next PowerPoint. So it's the basic principles of flexibility training. It's basically stretching. The key term that we use is range of motion. They should be individualized, just like all the rest of the programs. It should be kind of a recurrent theme that you hear. Address the needs, abilities, and physical activity interests of each individual. Some things that I've added is temperature affects excuse me, flexibility. So if you're warm or hot, then that increases your range of motion. So this is the idea behind a warm-up. You warm up physically to get your muscles warm. I mean, you increase the blood flow, that gets the muscles warm. You're also having various hormonal effects and increased vasodilation and increase the nutrients associated with blood, so you get more oxygen and you're getting energy from other areas potentially, and those are other benefits for the warm-up. But excuse me, a large benefit of the warm-up is just that it physically gets you warmer, and by physically getting you warmer, it increases your flexibility. So, and that's also the idea behind hot yoga. Those individuals are in a hot environment, and that helps increase the flexibility. Now, once you get into a normal environment, that flexibility advantage that you have is gone. Also, the opposite is true. If you're in a cold environment, that will increase stiffness. So if you're watching a football game, I grew up in New Jersey. I went to graduate school at the University of Pittsburgh, so I was used to being in the cold, and especially at Pitt. We'd watch football games in the cold, and you get up from that, and you're pretty stiff. Your flexibility is definitely decreased. So if you're in a cold environment, the opposite occurs. Some more comments. Ideally, the subject should reach a normal range of motion. So in the Heyward text, and I think probably in the ACSM, they have ranges of motion for various joint structures. Now, keep in mind that 0 is where you start from. If you have less than 0, a negative value, then you're hyperextending that joint. When I had my ACL reconstruction, they wanted my knee to get to a -5 joint angle, so they wanted a little bit of hyperextension of the knee, not a lot, very little. In fact, if you're measuring things with the goniometer, it's difficult to even see a -5%. But that's what they were trying to shoot for. So when you see 0 range of motion, or 0 being the starting point, that just means you're starting from a fully extended type position. So this would be 0. If my elbow is hyperextending, then that's going to be a negative value. And as I'm going through the rest of the range of motion, what you'll see stated is what this angle right here is. And that's a big thing in physical therapy. They do that a lot. You can also do it in exercise physiology and exercise prescription, especially if you think that there's an issue that needs to be addressed. But the key here is that we want a normal range of motion. We don't want you to have extremely high ranges of motion, the last thing that's listed. So that will increase your level of joint laxity. There's more movement inside the joint. It's harder for the muscles to support that joint because the physical forces that you're putting on it are going to be greater. If those muscles are very strong, then it can counteract that, but oftentimes it cannot. So if you have, what we have here, gymnasts, dancers, contortionists, some acrobats, people with Ehlers-Danlos syndrome, especially gymnasts, and you're not only in a highly flexible state, but you're also going with a lot of velocity, and that can increase your risk of injury. So, and also what I don't have listed, but there's a video, you can probably find it on YouTube, of cheerleaders, and the instructor was forcing high levels of flexibility. All that is bad. We don't want that. If you need that from a performance perspective, that's a choice that you make. But generally, for the general population, we do not want hyper levels of flexibility. So just kind of keep that in mind. Women tend to have higher levels of flexibility than men. There we go. I put together some flexibility videos so you could pause. Excuse me, you can pause and watch them. So you can pause it and paused. Maybe watch them. Okay, we're back. So this first one was of a individual, and for this individual, I put this in there specifically because you could tell that this individual is very strong around her flexibility. So I would be less concerned about this individual as a contortionist because you could see how strong she is. I mean, she's not a big, bulky woman or girl, but she is obviously, to be able to do the stunts that she does, she's obviously very, very strong. I have a Jim Carrey video. And I don't know, I didn't see anything on the web that he would have Ehlers-Danlos syndrome, so I don't want to say that he has that. My guess is that he does, but there's nothing documented to say that he does, and I just want to make that clear. But when you look at some of the levels of flexibility, and in this video in particular, and you could, especially, you get to that minute 30 part, and his what he's doing with his arm is just not normal. So again, you don't see him doing that anymore. He did that back in the day, and I would imagine that he has a certain level of pain or a certain level of injury associated with doing those movement patterns. Also, I put the last one in there just to show that you could be a large individual, you could have a lot of muscle mass, and you can have high levels of flexibility. If you look at the buses around town for the advanced financial, it's some sort of credit loan, money loan sort of thing. They had a commercial that I saw once, and you see that silhouette of an individual who has a certain amount of fat mass on her, but she has a high level of mobility. So whether it's this video from of the bodybuilder, or whether it's somebody that's overweight or obese, you could still have high levels of flexibility, normal levels of flexibility, even though you're in that state. Now, generally, you'll see a lot of the bodybuilders, they'll have decreased flexibility. You'll see obese individuals that have decreased flexibility. But that's not a guarantee just because you are that size that you have to be inflexible. I'll use these guidelines, and I do this across the board. So whenever you're looking at issues of standards for frequency, intensity, fit principle, this is what I'm always going to go back to. So 2 to 3 days a week. Stretch to the point. Now they'll say different things. This says to a feeling of tightness or slight discomfort. I use the term moderate discomfort, but we never want the person to be in pain. So always differentiate between discomfort and pain. Sometimes it's hard to differentiate between that, but there's definitely a difference that's going on there. So just be careful. Hold a static stretch for 10 to 30 seconds. For older individuals, it can be 30 to 60 seconds, a little bit longer. Generally, what is in the ACSM position stand doesn't look like it's, it's listed here with the volume. 60 seconds total for each stretch. So add up those reps, so to speak, of 10 to 30 seconds to total up to 60 seconds. PNF stretching, we'll talk about that in a bit. That's the resistance, relax stretching, contract, relax stretching. So 3 to 6 seconds of contraction. And then followed by 10 to 30 seconds of assisted stretching. The type, we'll list the types as well. Gives the volume, the pattern, repetitions, 2 to 4 reps, but the whole key is to get to that 60 seconds. And the progression should be to get to a normal range of motion. If you're already at a normal range of motion, then you want to maintain that normal range of motion. But if your range of motion is low, then that's the point you should progress to. You should not progress to having extremely high levels of flexibility, at least not from a health perspective. Training principles, specificity. You work on the joint, the you work on flexibility for a specific joint. Again, I state for the overload, it should be the point of moderate discomfort. The other slide said light discomfort, but it should always be below the point of pain. So, kind of keep that in mind. And that was the problem with the cheerleading video. It was out of Denver, Colorado, where they were obviously pushing the individual to the point of pain, and that was unacceptable. Progression, increase the duration of each stretch or increase repetitions. Inter-individual variability, point of pain, stretch tolerance, and perception of stress and pain vary by individual. This is something that was listed in the text. Again, we do not want pain, but the definition of pain can be different things to different people. Here are the different types of stretching. We have the ballistic stretching, the bouncing type stretching. You'll see this with karate. You'll see this with martial arts and things like that, where it's more of a ballistic type of movement. That helps increase the stretch, but you also increase your risk of injury. Dynamic or slow movement stretching involves the gradual transition from one body position to another. You'd see this more in yoga and Tai Chi. Static stretching, slowly stretching a muscle and holding it for 10 to 30 seconds. This is typically what we do, is the static stretching. Active static stretching involves holding the stretch position using the strength of the agonist muscles, and it's a common form of yoga. So we're kind of mixing and matching some terms here. Passive static stretching involves assuming a position while holding a limb or another part of the body without the assistance of a partner or device, using such an elastic band or a ballet bar, those types of things. And then the PNF stretching is the contract, relax stretching, partner assisted stretching. So the pros and cons of active stretching: client moves the body part without external assistance. And also, what's not listed here, there's also dynamic stretching. And dynamic stretching would be doing certain exercises that are going to increase the stretch response. And things like a lunge will do that. Doing a lunge with your back foot on a elevated bench or something that's a little bit elevated is also going to increase the stretch of the quad. So things like that. The dynamic stretching is really a good thing, and as I mentioned before, it's something you can incorporate into the other things that you do. So then you're doing, in essence, a resistance exercise, a stretch, and a neuromotor exercise all in one. So it saves time. It saves time, and it's a reasonable way to kind of combine things. Active assisted stretching, where you as the trainer are helping the individual stretch. So that would be that type of stretching is the active assisted. Also with the active assisted stretching, this is especially where you need to get a feel for the individual. So I did stretching in a physical therapist's office, and I had a man that was about my age stretching me, and he would always give me a good stretch. He was fairly aggressive. And then I had a couple of physical therapy students that were females, and the stretching that they did really didn't stretch me out at all. It really didn't do much of any good. So you need to figure out the touch. You don't want to be a big, strong, aggressive guy and stretch an older individual and potentially hurt that individual, an 80-year-old client or whatever. You don't want to hurt that individual. In that case, the girls that were stretching me would have been more appropriate. But you also want to make sure that if you're stretching somebody that's younger, that you're aggressive with it. So kind of keep that in mind with the active assisted stretching. Now here's some notes from the book. Again, point of discomfort, not pain. The risk of injury for the ballistic is definitely higher. With the slow static, it's low. The PNF, it's kind of in between. The degree of pain can be greater with the PNF stretching. The resistance to stretch is going to be highest with the ballistic. You can get very good flexibility with ballistic stretching. It's just that you increase the risk of injury as well, so you need to be careful. The practicality, the static stretching that we do is the most practical. It's also pretty efficient. Now, neither of them is going to have much energy consumption or energy expenditure. Excuse me. You just don't expend much energy with stretching. You need to do those other forms of exercise to address those. And for increasing the range of motion, the PNF stretching is really the best for that. So if you're in a therapeutic situation, doing the PNF stretching is really probably the best. So you have the contract, relax. You contract or you push against the individual's limb. They push against you, and then you relax. You do that for 3 to 6 seconds, then you relax for 10 to 30 seconds. The contract, relax agonist contract. So initially, it's the same to the contract, relax, except the client assists the stretching phase by actively contracting the opposing muscle group. So that improves the range of motion as well. It's a different way you can do things. They show a couple different types of stretches here, or ways to do the PNF stretching. The neurophysiologic mechanism that's there is you're working on the Golgi tendon organs and the reflex and inhibit the stretch reflex and Golgi tendon organs. So you're trying to override those systems. So similar to resistance exercise, to the ideas that go behind getting stronger through resistance exercise. Designing a program, you identify the different joint structures, select the appropriate stretches, include one stretch per major muscle group, and then select the exercises for the problem areas, especially address the problem areas. Familiarize yourself with the stretches, and I'll add to this, when I was in cardiac rehab or working with cardiac rehab patients, sometimes the older individuals can be clueless. They don't know what the heck they're doing. So, you really need to show them and get them to make sure that they're doing it the right way, and kind of talk to them to make sure that they're feeling it where they're supposed to feel it. So sometimes they'll do it. It looks kind of right, but the way that they're putting their center of gravity or their weight, they're not really doing anything. So kind of keep that in mind and work with them appropriately. Follow the ACSM guidelines. And for people with lower levels of flexibility, you might want to do shorter bouts but higher reps. So do the 10 to 15 seconds, but do it more times. And then you're progressing the stretch by changing either the stretch duration or the number of reps, and increase the stretch so that they finally reach a normal range of motion, or the ideal range of motion. You should do about 10 minutes per day. Try to do it 2 to 3 times per week, and that's in the previous slide. It's better to stretch after an exercise program rather than before, so it's a good way to cool down from a strength or cardio workout. If you're working with a team, do the stretching really after the exercise program rather than before. Oftentimes we saw people stretching before the exercise program, and it's really better to stretch afterwards. There's vibrational therapy. It's a vibration platform, and it has a high frequency vibration. I looked it up on PubMed as well. I don't really understand the mechanism behind that, but apparently other people have studied it extensively, and there is a mechanism behind that. And when you're doing that type of training, the good thing about it is that you could get people to weird joint angles to work a muscle group that's kind of hard to stretch or hard to work on. So one of the things that I saw was soccer players in Europe, which is a very high cost commodity. They would get groin injuries. I would think that this would happen in hockey too. And they would stand in kind of a stretched out position with one foot on the vibrational platform, the other foot on the ground. And then they turn the machine on or the platform on, and that would help stretch and get at those muscles that are associated with being in that position. And trying to exercise that position is going to be kind of challenging. So that was a way to kind of get at that. So those weird joint angles, it's a way to increase the strength and the flexibility in those weird angles. Stretching is good for older adults, definitely good for older adults. Caution when using the PNF stretching. You just want to make sure that you're not hurting the individual, and so listen to the individual. And every individual can benefit from any type of exercise program: strength, flexibility, aerobic, neuromotor balance, no matter what age they are. And that